Hi, it's Conrad Fischer, and welcome to our final chapter in the introductory section of excitable tissues and skeletal muscle. And in physiology, with this last section of skeletal muscle, we're looking at the mechanics of how muscles move. And it is relatively simple but indispensable about the concepts of preload, inotropic capacity, and afterload, because it underlies the understanding of the most common reason to be admitted to the hospital in the United States of America: congestive heart failure. Now, congestive failure is a difficulty with the contractility of tissues. Now, that doesn't mean that the most effective therapy is a positive inotrope to make it beat more, because they cause arrhythmias and ischemia and arrhythmias. But the concept of preload, inotropic capacity, and afterload is indispensable. The preload means how much you have stretched a muscle prior to contraction. How much have you stretched a muscle prior to contraction? Now, when the muscle stretches, just like a rubber band, it pulls the rubber band, and that pulling of the rubber band puts a kind of a tension to return to its normal size and shape. So, just like pulling a rubber band, that passive tension creates a certain motor ability to be able to contract. That passive tension. The greater the pre-stretch of the sarcomere, pulling the rubber band. When you pull the rubber band, that is passive tension. What I mean by passive tension is just by stretching something, it's going to want to recoil. And when you stretch the muscle, it wants to recoil. That's called passive tension. Just like I pull the rubber band, it wants to recoil. Passive tension. The more you pull it, the more it wants to return to normal. That's understandable. It's like anything that you stretch, it wants to return to its normal size and shape. Now, afterload is how much work does the ventricle need to do to push blood out of its ventricle, out of itself. How much work does the ventricle need to do to push blood out of itself? Afterload is no different than lifting weights. The left ventricle is contracting. The left ventricle supplies your brain and all the other important organs. It essentially is pushing blood up out of the aorta, and that's a lot of pressure because it's got to maintain enormous perfusion of your brain, your kidneys, every organ in your body. You're going to die. How much does it have to push? That's its afterload. Now, the afterload says, how much do I have to push to get blood out? This is a big deal, because the higher the blood pressure, the more the load. The higher the blood pressure, the more the load. It's no different than weightlifting. That's why in congestive failure, the drugs that lower mortality, ACE inhibitors, angiotensin receptor blockers, spironolactone, beta blockers, all of these drugs decrease renin, angiotensin, aldosterone. All of these drugs decrease afterload. What do you mean beta blockers decrease afterload? Well, beta stimulation is one of 3 stimulants for renin, right? This concept underlies the entire management of congestive failure. Because between 1782 and 1982, we thought that giving a positive inotrope like digoxin, and then later a diuretic, would solve the problem in congestive failure, help that heart beat more, but they don't lower mortality. It took 200 years. It took 200 years for us to figure out as a profession, a learned and noble profession, that we were killing people with digoxin. 200 years. 200 years to learn that digoxin, although it's a positive inotrope, doesn't lower mortality. You know, the concept of the randomized prospective clinical controlled trial, placebo-controlled trial, is entirely a concept of the last 60 years. It's a post-World War II concept. Basically says, I know you can think an idea is great, but have you tested it? Have you given one group a placebo and the other group the drug that are completely matched except for the one variable? and then see who does better. It's a new concept. And what we know is that when you have a person who's got congestive failure, things that decrease the amount of work of the heart make you live longer. If you work, you increase oxygen consumption. When you increase oxygen consumption, become hypoxic, you're predisposed to arrhythmias. Afterload reduction decreases oxygen consumption. Afterload reduction decreases the amount of ischemia, arrhythmias, and the amount of death. It says, how much do you have to work to lift that weight? You must decrease afterload to make people live longer. So instead, wouldn't you feel better if instead of having to lift a 100-pound weight, you only have to lift a 50-pound weight? And a beta blocker decreases the frequency. So instead of lifting 100 pounds, you're lifting 50 pounds and you're doing it less frequently.